NBC4 is proud to partner with the African American Male Wellness Walk.
Take advantage of free health screenings.
Register your passion team today.
August 12th at Livingston Park.
Good evening, everyone, and welcome back again to The Conversation. I'm Matt Barnes.
And I'm Jennifer Bullock. Thank you so much for joining us once again for this really important discussion. We've covered so many topics. This time around, we're going to focus on health.
Yeah, we did this last year. Call it your annual checkup of sorts as we hone in on the many issues that affect Black men and women when it comes to health. All of this, of course, as we prepare for the 20th annual National African American Male Wellness Agency Walk in Livingston Park.
Yeah, and of course, as we talk about health, there are a lot of different facets when it comes to health: mental health, physical health, men, women, children, all across the board. And it's something that we talk about so much because there is a lot of progress that's taken place, but a lot of issues that still remain. In fact, when it comes to health disparities in the Black community, it's an issue that really has been prevalent for decades. A recent survey by 4 Ohio health equity nonprofits found that 60% of Black women and 41% of Black males felt they were either disrespected or dismissed when seeking health care.
Numbers like these reaffirm what Black people already know. Our Caleb Michael spoke to an Ohio health doctor who is trying to do her part to tackle this head on.
I know that I'm only one person. I can't change the world, but I know that I can be an impetus or a spur to change.
One patient at a time. It's a mantra Ohio health doctor Ashley Cremona Simmons takes to heart. It's partly why she became a doctor.
Some of my early memories was my pediatrician, Dr. Darden, and that kind of stirred my interest in medicine.
Black doctor?
Yes, he was a Black physician, owned his own practice. I thought he was the smartest man in the world, and that spurred my interest.
A recent study published by the Health Policy Institute of Ohio found alarming disparities in regards to Black Ohioans. It found Black Ohioans are much more likely to experience racial discrimination than white Ohioans, and that a Black state resident is 10 times more likely to be treated worse in healthcare or at work due to race.
What's your reaction to those?
Unfortunately, I can't say that's something that I didn't know, or isn't it something that even I've experienced just as a Black woman myself.
It's the recognition of these disparities that is helping Dr. Cremona Simmons and her colleagues at Ohio Health tackle these issues head on. For instance, she's helping develop a diversity, equity, and inclusion curriculum for training physicians.
It's my hope that going through this curriculum, they'll be better suited to treat patients that are different from them.
Okay.
And next year, Ohio Health Doctors Hospital, they're opening up a community health clinic to meet the needs of those they serve.
It's going to be housed with emergency medicine physicians, family medicine physicians, pediatrics, as well as pharmacists. We're going to have collaboration with the community, food banks, mental health services, addiction medicine, all of these things to combat the social determinants of health that we see our population is facing.
They even have a program called Made for Medicine. Ohio Health physicians take Black middle school students interested in medicine and give them in-depth training through monthly meetings and resources to help them pursue a career in the medical field.
So I can say that statistics show when you have a concordant provider, we do have better health outcomes. And that's why it's important to increase underrepresented minorities in medicine.
All of these programs, Dr. Cremona Simmons says, are great, but this is just the tip of the iceberg.
Even with all of this work in combating health inequities and combating social determinants of health, these things will continue to persist until we have structural changes as well as policy changes that combats both the historical and contemporary racial injustices that have led to these health inequities.
Because where we come from is important in determining where we're going.
So I just want to hone in on the fact that it's not about patient compliance. It's not about, oh, am I taking my medication or listening to my doctor? There are structural and systemic factors that have created the inequities that we see today.
And those need to be solved for us to really make the progress we hope to see.
Absolutely. It's multifactorial.
So Dr. Cremona Simmons, really great to talk to. She's a young doctor at Ohio Health instituting these changes. Her biggest point was there are systemic things that need to shift for us to really see the trickle-down effect.
Yeah.
But something we were talking about, you said you had a black doctor growing up.
Black pediatrician, black dentist, yeah.
Yeah, did you?
Did not.
I didn't either. So what was that like for you? What was that experience like with seeing somebody who looked like you giving you that health care?
It makes you more comfortable, even as a kid. You know, you don't really think about it as a kid, but as you think about it now, yeah, I was more comfortable. I knew their family knew mine. And so I think that does matter in terms of you feel like the care you're getting is a little bit more personal.
Yeah,
if that makes sense.
We've had that conversation too, even with education and seeing black teachers or black professors, and maybe them having a little more understanding of what you're going through or why it may be difficult to express concerns that you may have physically or mentally.
Yeah, and it makes you feel more comfortable. You might be more willing to share, talk about experiences. They can relate to you more. And so this all ties into all the disparities, the health disparities you're seeing. We understand what they are. But kudos to Ohio Health for taking kind of a lead in these kind of things. They have that Made for Medicine program. They're taking middle school students who have an interest in medicine from a very early age and getting them real hands-on experience. And then also taking black doctors, minority doctors, and helping them kind of trickle through the pipeline and say, hey, we want to mentor you. We want to help you get better. So when you see people that look like you, you're able to help them, and vice versa. Even for the white physicians that are in there as well. They're helping them so they can treat anybody that comes through Ohio Health stores. Yeah,
it's so important too because it reflects the community that we're in now. We're seeing so much more diversity, not even just in terms of race, but in terms of socioeconomic backgrounds, religious backgrounds, and that access, having that availability, being able to have that level of comfort where anyone who walks through a door can look at a physician and say, okay, I'm in a good place here.
And the level of comfort comes to the play that just even going to the doctor. Because some people won't even go because they just don't they have that lack of trust, that lack of compassion, empathy, whatever it might be that they don't feel like they have with that doctor that they need. They kind of have that when it looks like someone that looks like them, right?
To that point, they're opening a community clinic next year, Ohio Health. And their goal is to reach everybody, right? They touch so many unique communities in that area of Columbus. And so they want to be able to connect with everybody, but it's a holistic approach, right? It's not just about medicine. You need to be able to, you got to eat right. You got to have good mental health and all these different things. So it's about meeting people where they are and hopefully addressing them. That's kind of on the base level of addressing these issues. But they're looking at the whole picture. It's not just let's address this one thing. They're looking at the entire problem. And hopefully, in the next couple of years, we'll see some of these positive changes right here in Columbus.
Yeah, that's great
to see that. Yeah. All right. Thank you very much, Caleb. Appreciate it. And speaking of all those different ways that we need to improve our health, got to get moving, right?
Absolutely.
Just a little bit, right? Yeah. And one way for black men, especially, to maybe bring down some of those numbers that are concerning to them is to get up and moving. That's where a group like Black Men Run comes into play. For the international organization, has been now for about 10 years. They've been encouraging black men to run or walk to promote that healthy lifestyle. That includes a chapter right here in Columbus that meets each and every week in the name of fitness and fellowship. It's another Saturday morning at Blacklick Woods Metro Park, and another morning for Black Men Run to gather and get moving.
It's a healthy brotherhood of not just social networking, but impact and influence. I think it pays off in a myriad of ways, whether you're talking about us struggling with coronary heart disease, issues like that really adversely affect us, but it's also that meditation in motion.
Mark Stevens joined Black Men Run Columbus in December 2021 by accident.
I literally ran into the group. Like, I don't live too far from here, so the group was running, and I literally came down the path here and literally ran into the back of the group, and Malik picked me up after that.
Now, 18 months later, Mark has completely changed his life, one step at a time.
Since I've been running, I've lost 75 pounds. I've cut down my cholesterol. I had high blood pressure, high cholesterol. I dropped that down, so I'm in the healthy levels on all that range, and that's the testament to the group. It's the brotherhood. It's just, each one teach one. We're here to, help you reach your fitness goals, or, just being a part of this team, or almost this family, almost to this point now.
A family that takes their message of brotherhood and health across the country, including to Alabama, where the group had 2 teams running a 51-mile race from Selma to Montgomery, mimicking the historic Civil Rights March in 1965.
We started on the Pettus Bridge. That's where the race started. Pettus Bridge, run like straight up the highway. It's kind of boring terrain, no trees. So we're lucky it was in March in Alabama. And so we had a nice run. It is significant. We visited a lot of landmarks. We went to the Justice Museum on the way out of town.
Good job! Woo!
But it's these Saturday runs at Blacklick that are the foundation for the group, giving black men of all abilities the opportunity to get involved in the lifestyle of running.
We don't have any limits, so I like to let them know that their limit begins and ends with them.
But it's not like track practice where, there's somebody left behind. We accept all people. If you want to walk, you can walk. You want to run, you can run. And that's the thing, it's brotherhood. We come out here and we talk to each other, we build each other up. We got people who race. We got people who are out here just trying to lose some weight. We got people just trying to work through some things. The whole point is the forward movement. The only pace that matters, is forward. And we're out here to promote that. No man left behind, that's our motto.
And let me tell you, as someone who's training for a half marathon myself, I was inspired to get out there and run with those guys. It's just cool to see the camaraderie, the fellowship, the brotherhood that they have.
Yeah.
It reminds you that when you have some representation and you're around people that are familiar with the same struggles and that you might be going through, it pushes you even more. It inspires you, it motivates you. And that's what I love about that group.
And what about that group setting, right? It helps so much to really stay motivated and to have somebody hold you accountable.
Yeah.
So when you have someone to lean on, but also say, hey, pick up the pace, let's go. We got to stay in this through the finish line. It's incredible to see them banding together and really making that happen.
And we've all been a part of sports teams. You know how much that means. But listen, whether you're a walker or a runner, they assure me, they'll assure you, any speed. Go out there and run with them at Blacklick Woods. They're ready and willing to accept you as part of the group and help you hit your fitness goals. We all know how important movement is.
Absolutely.
As long as you're moving forward, you're making progress.
Absolutely. Love to see that. And speaking of men, now we want to talk about women. We're really working to close the health disparity gap for black mothers and to reduce the infant mortality rate here in Franklin County. That is why Celebrate One was created in 2014. And almost 10 years later, a black mother is now leading the charge as executive director. I spoke with her about stepping into this role, and for her, it's personal.
So I've been in Columbus for about 10 years now, and had a number of positions, and the most recent one was with the Columbus Foundation. Delighted to have had the chance to serve there. And now I'm excited to begin my journey with Celebrate One.
In June, Danielle Tong took her experience with maternal and women's reproductive health from the Columbus Foundation to Celebrate One, now serving as the organization's executive director.
Celebrate One is a collective impact organization, which means that we partner with organizations across the spectrum for people who are birthing. So anywhere you are on that journey, whether you're preconception or within the first year of the young baby's life, we are connected to those organizations, both from a position of being able to make referrals, but also from a partnership in how we approach this work and how we get to solutions together.
Solutions for what the city of Columbus calls the crisis in our community. In Franklin County, 3 families lose a baby every week. 150 infants die every year. And when race is factored in, African American babies are dying at twice the rate of white babies. Celebrate One and those partners Tong mentioned works to address and take on the most significant factors that contribute to that high infant mortality rate. Connecting the disconnected, eliminating sleep-related deaths, and reducing premature births, something Tong experienced firsthand 7 years ago.
While being on a job that focuses on infant maternal health, I delivered my youngest son at 29 weeks. He was so tiny, he fit on my hand, and he was hooked up to all of these machines, and no amount of information that I had on the topic really mattered for me in that moment.
That moment and the 8 weeks after his birth until Tong was able to take her son home.
And leaving the NICU, I felt like I had to be in this space. And so it took me a little bit of time to, finally make my way here, but it really does feel like a full circle moment for me.
As a woman of color, a mother of color, leading the charge for change for others like her.
I really think it's important for the person who sits in this seat to have skin in the game, to really need these outcomes to change. And my experiences have happened, but I never want anyone to go through what I went through or worse than that. And so that's my goal, really, in this. I came into this job because I feel like this is possible the entire span is possible. We need a person who can bring folks together, who can sit down and keep them anchored to a cause. We need a person who's able to measure the outcomes of that work. I feel very confident in my ability to do those things. I'm very hopeful. I come to work every single day with the full and fervent belief that we've got this.
It was such a fascinating conversation to have with Danielle. We really actually related on so many levels as moms and as women of color, as mothers of color, having those similar experiences too with babies in the NICU. But for her to say that was really the catalyst. This is what really drove me to make a difference. And she is just really excited about what the future holds for her in this position, not just for her, but for women all across the county. Celebrate One has been doing such great work since its inception. And what I love too is they want to make sure the whole neighborhood, the community rallies around this cause. This isn't just, a Columbus issue. This is a nationwide issue. Right, exactly.
But as far as Columbus, we can do our part to help Black mothers get more comfortable and to make sure more kids get to celebrate that first birthday. And part of that, she was saying, these partnerships are vital. When you talk about community partners, businesses, but also individuals, and even something as simple as the baby showers that they have regularly. She said those donations, that education, that awareness, and really just rallying around these mothers, no matter what stage they are in, whether it's pre-conception, if they're just thinking about getting a family going, or if they've had a baby within the first year of that baby's life, just making sure they know that they are supported and working to develop those partnerships to make sure that they have the resources they need. And Beth, how much of it is about the information that Celebrate One is giving to these new moms who may be really scared at this very scary moment in their lives? Yeah, it's pretty incredible to see how that is really a necessary part of all of this. She said education is so important, awareness is so important, and she is ready to go. She's ready to just jump in, dive in, full force, and make sure that she really just, gives as much as she possibly can to this job. So you say stay out of her way. She's on a mission. Yeah, just get out of her way. She is on a mission. It's a personal one, too. I love to see that. And it's so important to continue that conversation about health in the Black community. And let's focus in on one specific type of health, mental health. For so many in communities of color, the conversation about getting help when it comes to mental health is really hush-hush. Many are concerned that opening up is going to be perceived as a sign of weakness or defeat, but a local organization is really working to remove that stigma. Sierra Johnson tells us the story of one Black man's journey to regain control over his mental health and the organization that has welcomed him and so many like him with open arms.
It was a pivotal, life-defining moment.
Like, I'm 26, 27 years old at the time. I don't really have any money, but I had college degrees, but I couldn't get a job. And so it was just like, what do I have? And I felt like me asking my mother for money was more of a burden than anything.
Feeling hopeless and out of options, about a decade ago, Chris Sewell called his mother, explaining he wanted to end it all.
Vividly, I remember calling my mother and telling her, I don't want to live anymore.
Struggling with what he now recognizes as depression and anxiety, Chris says that moment in time could have been the end of his story.
So her question was, who's going to help me raise, your brother and your sisters?
According to the latest data from the Ohio Department of Health, which took a closer look at death by suicide in 2021, suicide rates climbed. Suicide is now the 12th leading cause of death for Ohioans, an 8% increase from the year before. But in that data, something more startling, a drastic increase for suicide deaths for Blacks. From 2019 to 2020, the suicide rate for Black males increased 8%, and for women, 14%.
Because we know suicide or mental health doesn't have a face or a color or doesn't have a socioeconomic, right?
But Chris acknowledges that for so many Black males, there is a hurdle that prevents the candid conversation about mental health, suicide, and depression. Stigma.
We're all kind of experiencing, going through different things. It's like the whole stigma around burdening others with your own problems.
Our main concern right now is awareness, removing the stigma and having the conversation.
But a Central Ohio organization is hoping to remove that stigma specifically for people of color and ensure that stories like Chris's don't have a tragic ending.
It makes me feel there's so many more out there that's like him, and we've got to reach more. But it also gives me hope to know that we are on the right path.
Proudly wearing a simple message on her shirt, "Life is better with you here." Tracy Garrett works with the organization of the same name. The organization works to reduce the stigma of suicide and mental health in a community that is also battling other forces, the burdens of racism, discrimination, gun violence, and even the absence of mental health resources. Factors that both Chris and Tracy agree only compound what can already be a complex issue to address.
We have a thing in our Black community to say, "How are you doing?" "I'm good, I'm good." Well, we're not always good, and that's okay. And be okay with that. And by having the conversation, you're able to remove the stigma. And by going and talking about going to a therapist, it's okay.
And to help facilitate the conversations around mental health, someone who has faced the issue and continues in his fight each and every day.
That I want to be the visible representation and say, hey, I'm going through this, and you can get through it too.
You don't have to go it alone. There's people to help you. There's people that's passionate about this and truly want to help you to stay here and to know that life is better with you here.
So I think the best thing to come out of this is to know that Chris is still working on his mental health. He says he goes to therapy multiple times a month, and he's just really adamant about continuing the progress that he's made while still talking to other folks that are in his position about how they can come out of it as well.
Well, I love, even just before we saw that story, you mentioned it's a journey. This is a journey. Mental health, wellness, whether you're in a struggle, no matter what it is, it's a continuous journey, making sure that you get what you need, but also making sure that you maintain that health. We talk a lot about maintaining physical health, staying active, but maintaining your mental health is just as important.
And did he mention about how sometimes Black men can be too proud to want to get help, especially when it comes to this?
Yeah, we were talking on the side, and he mentioned that he didn't want to burden his friends because he didn't think his friends could handle it. I mean, you know, sometimes depression can be circumstantial, and you know, your mid-20s is a difficult time for so many folks. And when he was going through that, he said he didn't want to burden his friends. He didn't want to be a burden to his mom, who was taking care of his siblings. So I think part of that conversation also goes to it's better to be a burden than to not be here.
Wow. Yeah, that's a great point.
Great way of putting it. And I hope people always understand there are resources out there for you. Whether they're online, whether your family members can find it for you online. Because as you said, it's more important for you to be here than anywhere else, right?
Yeah, and no matter what you think, if you say, I have a problem, but somebody else has it worse. If it's affecting you, it's a problem and it's legitimate, and making sure that you express those concerns and have your feelings validated. Like you said, I'd rather somebody be a burden than to not be here with me at all.
And there are resources. It's so important for him to share with others that there are resources. A lot of resources too that focus on the Black community. There are so many things in a Black person's life that so many others may not understand. So to know there's someone that gets what you're going through, it's really important.
That unique touch that he puts on it, that personal impact, I'm sure really makes a big difference. Thank you, Sierra. Appreciate it. You know, we mentioned earlier that the African American Male Wellness Walk is celebrating its 20th year. Now, NBC4 is a proud sponsor of that walk. For 2 decades, the walk has brought people together to prioritize their health, and it has even grown now to walks in 16 other cities. Our Jordan Dunlap talked with the CEO and co-founder of the African American Male Wellness Agency, John Gregory, about all that they've accomplished.
For years, the African American Male Wellness Walk has been working to reduce disparities, premature death, and chronic diseases among African American men. While mental health in the Black community hasn't always been an open discussion, they've been committed to saving men's lives one person at a time.
And, you know, nobody really kind of really believed in what we were doing at first. And so we were just gathering Black men up.
According to the Centers for Disease Control, around 57% of African American men have high blood pressure, many rarely getting the help they need. Reports also show encountering racism at an early age can also play a part in the mental health of Black men. When it comes to the walk, Gregory says it's much bigger than a moment.
They can see Black families, they can see positive Black men. And so many times what we see is images that are pointed out there that we're not as positive a community as we are. But this really shows the power, and it shows how we work together to build to this.
From the on-site health screenings to the annual 5K and the hundreds of vendors, the walk unites communities from all over the country. While the walk has gained much success over the years, Gregory says that people didn't always believe in what they set out to do.
We just kept believing that God would bring in the finances to give us the ability to do this, and that then he would send the message that this is something that African Americans should participate in because it's a great family event.
In addition to helping Black men thrive in their health, they've also created space for women through an initiative called Uplift Her. Their gatherings offer on-site health screenings and resources as well, but also extend a sense of community and support in the process. When it comes to the impact of the walk, Gregory says it's about Black men setting an example for their families, friends, and their loved ones.
This is an example of Black men who are rising up to make sure that their families are healthy and they're able to live a longer life because they have been aware that what they need to do to make sure that they can be around to be there for their children, grandchildren, and their family and community.
It truly is amazing, frankly inspiring to see all the great work that the African American Male Wellness Agency does. And it's not just for men anymore. Again, we're talking Uplift Her. Yes, you have Real Men, Real Talk, but all these different programs and resources that they're giving the community to make sure that they stay healthy so we can improve the lives of everyone.
And it's incredible to see how much it's grown, right? Year after year, we see more people at the walk, but it's outside of Columbus. We're seeing this happen nationally. It truly is a movement because we've seen just how important it is. Hearing those incredible stories from community members about themselves, their families, their friends, and how necessary it is to really take care of yourself, not just for yourself, but for everyone around you as well.
It's such a great group of people. I mean, it's big, it feels like a big family reunion, doesn't it? As everyone comes together and gets ready for the walk. So we hope to see you there. 7 a.m. is when they'll be at Livingston Park, but again, you can get there at 9:30 for the walk, and we'll have a great time. Not only celebrating all the great work that the agency has done over its 20 years right here in Columbus, but all the work they continue to do and will continue to do. And hopefully you get your numbers checked because, again, it's all about staying healthy, making those healthy choices.
Yes, so many resources available. And make sure that you have that conversation with your family and your friends, your loved ones. Continue to have those sometimes tough discussions, but necessary discussions. And of course, continue to have this conversation with us. Let us know what you think, what you want to talk about, what issues are important to you, and we'll make sure that we have those discussions as well.
We'll be back in December with another edition of The Conversation. In the meantime, stay healthy. Thank you for watching, and we hope to see you at the walk on Saturday. NBC4 is proud to partner with the African American Male Wellness Walk.
Take advantage of free health screenings.
Register your passion team today.
August 12th at Livingston Park.